I did my undergrad at Kent State, and then I went to NEOUCOM, or NEOMED as it's called now, Northeastern Ohio University College of Medicine, and then I did my residency in Washington, D.C. at Washington Hospital Center. After residency, I worked in D.C. I worked for Kaiser Permanente for 3 years, and then we moved to Colorado, and there I worked for the U.S. Army. My husband was in the Army for 4 years, and then we moved back here, and now I work for Genesis. Well, I knew I wanted to be a caring kind of provider very early in life. I actually grew up in rural Coshocton, so I thought I was going to be a veterinarian. Went and spent some time doing that, realized I was maybe a little too compassionate for that line of work. And then I spent some time with my childhood pediatrician and realized that I really liked medicine. Thought I was going to be a pediatrician for a while there, but knew I wanted to go into medicine pretty early in life. Once I got to do pediatrics, I realized that I liked pediatrics, but I really enjoyed the obstetrics and gynecology field better, so that brought me down that route. I've learned to be a little more holistic in my approach to patient care, not always just with the mainstream medicine, but also trying to go into other things that might actually be affecting the patient, like their lifestyle and their sleep, and just what's going on at home. Make sure you're addressing all those issues, because often they can affect what the main issue is when they come in. The other thing that I really enjoy, and part of the reason why I'm a physician, is just getting to know the patient. So I let people, take their time, talk. Let me learn a little bit about you personally, because that helps me remember the patient, and it actually helps you in the future, so that if something comes up and they're not acting the same way, something's different. One of my patients that affected me and made this biggest impact on me when I was actually first out of my residency was a patient that was actually having troubles getting pregnant. And I went through a couple different miscarriages, a baby that had some malformations that they had to deal with, and then eventually she got pregnant and had a beautiful little girl. And it was, it was a really good experience, because I really got to know this patient pretty well, because they'd seen me a lot, and that is a patient population that sometimes gets kind of left out. The ones that are trying to get pregnant but can't. They don't always get the empathy and the attention they deserve. But it really taught me a lot about, really just sitting there and holding someone's hand when they're having a rough time. And, those kind of experiences and patients kind of stick with you, so that you can use that information and knowledge and, just that experience to kind of help people in the future. I offer pretty much full spectrum for OBGYN procedures. I have been trained in doing a lot of different minimally invasive surgery techniques. So I do my hysterectomies laparoscopically, abdominally. I have been trained in robotics and also vaginal surgery. I also do a lot of myomectomies through mini laparotomies even. Anything that helps make the patient's recovery a little easier. I also do full service obstetrics procedures and office procedures, things like sleeps and colposcopies, endometrial biopsies, and intrauterine device IUD placements. One thing I'd like my patients to know about me is that I am a mother of 3, and that I think that experience, having my own 3 kids, has given me a lot of empathy and also good experience to help my own laboring patients, but also helped me learn how strong a woman can be and what all we are capable of doing. So my favorite thing to do after a long day is to go home and spend time with my family. I have 3 boys, and they keep me outdoors mostly, so we walk, hike, bike, swim, kayak, anything to burn some energy. But it's just getting to spend time with everybody and spend time as a family is kind of how I unwind.